Hello and welcome. I'm so glad you're here. I'm Katie Altnew from the Becoming Mom Method, and I help couples get pregnant both naturally and IVF. I'm an acupuncturist and herbalist and the creator of the Becoming Mama Method, an online course that shows you how to boost your fertility naturally. So today we are going to talk about hidden secrets that your period and your body might be telling you about your fertility. So you're in the right place if you have been trying to conceive and it just hasn't happened yet, or if you've had a miscarriage. And I'm also going to do another webinar all about miscarriages. So I'll try to link to that below so you can check that out as well if that applies to you. So I'm going to share my screen with you just because I know that a lot of us are visual people, and I think this will really help you to understand the information. So you might be seeing tunnel vision right now. Sorry. I have some slides for you. Okay, great. So most of the women I see in my clinic have what are called idiopathic fertility problems. So meaning they have a hard time getting or staying pregnant for no known reason. So doctors can't diagnose a reason or figure out what's behind it. But here's the thing that there's most of the women I see, their labs come back as normal. So, but they still have very clear signs of less than ideal hormone balance. So they might have short or long luteal phases with spotting indicating poor estrogen progesterone balance, and that their bodies aren't utilizing progesterone well the way it should, which could lead to miscarriages or difficulty conceiving. They may have short or long follicular phases, also indicating poor estrogen and progesterone ratios, and that their bodies aren't utilizing estrogen the way it should, which affects egg quality and the uterine lining, which can make it difficult for an embryo to implant and to conceive. So they might also have night sweats and PMS or other signs of hormonal imbalance, even though their labs come back as normal. So according to their lab, they're fine, but clearly they're out of balance. And this information is also going to apply to you, even if some of your labs have shown that your hormones are out of balance, that you have low progesterone or high FSH or something like that. Stay tuned because there's still important cues that your body is telling you, and you can set these things right. That's the really exciting thing. So the thing I want you to know is that there are subtle signs and messages that your body could be sending you that indicates that your hormones are slightly off, could be blocking your chances of conceiving. So symptoms you may never have associated with your endocrine system and your hormones and fertility before, such as acne, insomnia, poor digestion, weight gain, constipation. Those can all be hormonally based. Most of us just haven't been taught to connect the dots between those symptoms and our hormones. So the best thing to do is to look at your symptoms, to notice what's going on in your body, to pay attention to it, to pay attention to what your body is telling you. And the best hormone test is your period. So unfortunately, most of us have been taught to suppress any symptoms going on with our period with years of birth control use or Advil, rather than listening to what our period is telling us and the symptoms. We're just suppressing those symptoms. And it's frustrating because the pill doesn't actually solve those symptoms. It's just a Band-Aid covering them up, which means we can't pay attention to the symptoms if we're just covering it up with the pill. But every month you get an indicator, an insight into your body's workings and your hormonal balance and inflammation and so many other things, and what your hormones are doing. And that's your period. Your period can give you great insight into all of those things. So I'm going to show you what your period, what it could be telling you. Okay. So your menstrual regularity, the length of your flow, the blood quality, as well as PMS symptoms are all fantastic ways to assess each month how optimal your estrogen and progesterone levels are for conceiving and maintaining a pregnancy successfully. So many of my patients don't know this information, and I think it's important to know what your body is trying to tell you and to be in tune with it, so that you can see where you might be having a little trouble and take steps to rectify that imbalance. So here's a rundown of the cycle from start to finish. So day 1 is considered the first day of fresh red blood flow. It's not the first day of spotting. I think that's confusing for a lot of people. And if you don't get that right, then you can be incorrectly calculating the length of your cycle and the length of your flow. But it's not the first day of spotting. It's the first day of fresh, smooth red blood flow. So your period should start with good flow, not spotting. It should become stronger and then ebb away smoothly. It should be smooth. You know how I think some people have it like stop for a day and then start again. And it shouldn't be scanty bleeding nor excessive heavy bleeding. And you don't want clots and you don't want pain. And bleeding should last about 4 or 5 days, ideally. So the first part of your phase is called the follicular phase, and that's from day 1, when your first day of bleeding, to ovulation. So this is when the estrogen levels in your body are rising, which thickens your uterine lining so that it can host an egg. An embryo can implant into the uterine lining wall, and it's developing the little follicles that are going to become an egg. That one of them is going to turn into the egg that gets ovulated that month at ovulation. So this phase is usually 12 to 16 days, and it can vary in length from month to month. So stress can affect it, and other factors can affect it. So if your period is varying in length, if your monthly cycle is varying, it's usually your follicular phase that can vary, and your luteal phase tends to stay the same. And if this phase is too short, if it's less than 12 days, then the egg doesn't have enough time to mature adequately before it's ovulated. And if it's too long, then it may mean your estrogen production is low and your egg quality could be compromised. If you have delayed ovulation and your follicular phase is too long, you're ovulating too late, that egg might not be at optimal quality when it's ovulated. Okay. So from ovulation to menstruation, that second half of your cycle is called the luteal phase. It's also between 12 and 16 days. And this is when progesterone levels are rising, which the progesterone levels help signal the body to keep the uterine lining intact. And it's when the progesterone levels drop that causes you to get your period, your uterine lining to start flowing, and that's what causes your period. So it's usually between 12 and 16 days also. And this phase, the luteal phase, is usually consistent from month to month. So if you know that you usually have a 14-day luteal phase, you can count on that again next month. And then as soon as you know when you ovulated, you should know when you'll get your period next. And you can figure out if you're pregnant without even taking a pregnancy test, if it's longer than that. So observing the luteal phase can help us understand your progesterone levels. So the follicular phase tells us about your estrogen levels. The luteal phase tells us about your progesterone levels and your ability to sustain a pregnancy in those critical first few weeks. So if your luteal phase is shorter than 12 days or longer than 16 days, then your progesterone levels might be too low for pregnancy, to conceive or to maintain a pregnancy. So eventually the corpus luteum from the egg, which is kind of like the outer shell of the egg, it turns into the placenta, and that later starts producing progesterone. But in the early stages of pregnancy, it's your body's progesterone levels that maintain that pregnancy. And if you think about it, if your progesterone levels are too low, then your uterine your progesterone is what keeps your uterine lining intact, then it's not going to keep it intact. You're going to get your period, even though there was an embryo implanted there, and it's going to slough out that embryo. So progesterone levels are really important. Next, you want to observe the intensity of your PMS symptoms. So how many are they? How many symptoms do you have? How severe are they? Things like acne, breast tenderness, headaches, insomnia, bloating, irritability. Those are all common. You're not alone in experiencing them, but they all indicate an estrogen to progesterone ratio that is not ideal. That's not optimal for fertility. So a lot of those symptoms actually can indicate estrogen dominance, which can be both excess estrogen, which is really common because our world is so estrogenic with a bunch of xenoestrogens, and a lot of us have poor detoxification abilities. Our body needs to detoxify from all that excess estrogen. So estrogen dominance can be caused by too much estrogen, but it can also be caused by too little progesterone, making both of them make you have estrogen dominance, which can cause PMS symptoms. So PMS symptoms can indicate hormonal imbalance. So again, pay attention to what you're feeling. So let's talk about what the optimal cycle looks like. So where your cycle differs from this cycle can point the way to where you might be out of balance, and a pattern diagnosis for us, for any healthcare practitioners you have, or for yourself. And we go over this more in the Becoming Mama program. But so what does medical research show about the optimal cycle in terms of conceiving? So the optimal cycle is regular, meaning that it comes at regular intervals. So studies show that on average, women with irregular cycles only had a 1/4 the chance of getting pregnant each month than those with regular monthly cycles. So your period should come at regular intervals. It shouldn't sometimes be shorter and sometimes be longer. And it should be ideally about 28 days long. Plus or minus a few days is fine. So this allows plenty of time. You know how we said the follicular phase and the luteal phase should both be about 12 to 16 days long. So this allows plenty of time for the egg to mature adequately and properly in the follicular phase. And it allows plenty of time for the embryo to implant in the luteal phase. It gives a good window for implantation. So both shorter and longer cycles have been associated with reduced fertility. Your follicular and luteal phases should both be at least 12 days and no more than 16 days. You should have a 4-day period. So the length of your period is also an indicator of a healthy uterine lining, a healthy uterine lining supports implantation. So if you have light bleeding, it can mean that your uterine lining is thin. And if you have really heavy bleeding, then that can also indicate poor uterine lining. Both of those cases can make it difficult for an embryo to implant into your uterus, which can decrease your chances of conceiving each month. You should have sufficient bleeding. So you should soak a tampon about every 4 hours during your heaviest flow. And it's pretty normal to have your first day be heavier and have it slightly taper off. But you don't want to have scanty bleeding or heavy bleeding, like we mentioned, and it should be pain-free. So for a lot of people, it seems like cramps might be normal and common, but it's not. It doesn't have to be that way. It's a sign of hormonal imbalance and stagnation and inflammation. And cramping and clotting with your period, they're not just a pain or a drag. They may indicate larger problems like fibroids, endometriosis in the worst cases, or just hormonal imbalance and inflammation. So if you think about having like congealed, thick, or clotted blood in your uterine lining, it can be hard for an embryo to implant into that lining. So you want it to be kind of like velvety and smooth and just thick enough for an embryo to easily implant into it. So think about how your cycle compares to this optimal cycle, and that will help you determine where your imbalance might lie and steps that you might need to take to bring it back into balance. So what I think is empowering is that I feel like we're just told when you go to the gynecologist and say, oh, I have cramps and PMS, they're like, oh yeah, that's normal. Just take the birth control pill or take Advil. And again, that's just suppressing the symptoms. The thing is that you can address these things naturally: diet, lifestyle, herbs, acupuncture, and it does not have to be this way. You do not have to suffer. And if you pay attention to your symptoms, you can address it. Yeah, if you know what to do. So you want to evaluate your period and see how your cycle compares to the optimal cycle. Okay. Next, you want to use your whole body as an indicator of how you're doing and where you're off balance as well. So your body has myriad ways of communicating with you about how healthy and fertile you are. So how's your digestion? Are you constipated? Are you bloated? Your bowel health indicates your ability to absorb nutrients, crucial nutrients like vitamin D and omega fatty acids, and vitamin B and folate, which are all really important for healthy hormones and a healthy pregnancy. Do you have acne or headaches? This can show that your liver and detoxification pathways aren't doing their jobs as well as they could. And inflammation can impede successful conception. So if you have symptoms of inflammation like skin conditions, IBS, chronic illness, and insomnia, then it's a sign that you need to improve your biochemistry and balance and decrease inflammation so that you can have healthier egg quality, balanced hormones, so that you can more easily conceive and can maintain a pregnancy. So all of these symptoms, even though they aren't directly related to your period, your whole body symptoms can also show you and point the way to where you might be out of balance and conditions in your body that could be preventing you from conceiving and carrying a baby to term. I'm also going to post a quiz, a link to a quiz that can help you understand your symptoms a little better. You can download it and see where your imbalance might lie and get a pattern diagnosis. It's just easy checklist of symptoms that can help kind of determine where you might be subtly out of balance. So check out that quiz. And we'll go over what to do about that in the Becoming Mama program if you want to know about that. So the good news is that once you know where your imbalance lies, you can get to setting it right. But you have to know where your imbalance is because all of us are going to have different things going on. Some might have inflammation, some might have poor blood flow, some might have estrogen imbalances or progesterone imbalances. We're all going to have different things going on, and we all are going to need to take different steps to rectifying that. So go through the checklist and the things we've mentioned before, see where you might be off, see how your cycle compares to the optimal cycle, and we'll cover how to fix each of those problems in the Becoming Mama program. But just for now, so that you can better get to know yourself, just see how your symptoms compare, get in touch with yourself, and you might get some clarity and some answers, and you might become aware of some things that can help you. Okay, so if you've been trying to conceive for a while and it hasn't happened yet, or if you've had a miscarriage, you might be wondering, why can't I get or stay pregnant? And this is an impossible question for me to answer without knowing more about you and asking you a million questions. But I can offer you a checklist of things that could be possibly stopping you from getting and staying pregnant easily. So you can see if any of these following things are applicable to you. Okay, so here we go. You might not be having sex at the right time. The trouble with fertility apps, so many of my patients and clients use fertility apps, is that those apps are often just making predictions and guesses and estimates based on assumptions and averages and generalizations, and not based on you and your body. So when it's trying to tell you when you're ovulating and the best time to have sex, if you're using an app to tell you that, you might be having sex at the wrong time. The best way to do it is to be in tune with your own signs of ovulation, which I think the easiest way to do that is with fertile cervical mucus, but you can also do your BBT or take OPKs. But I really encourage you to get in touch with your ovulation based on your own cues, not some fertility app that's telling you when the average person might be ovulating, because we're not all, just like everyone else. And okay, the next thing is you might be ovulating at the wrong time. So if you ovulate too soon, as we mentioned, there's a certain length of time that the follicular phase should be. And if you're ovulating too soon, less than 12 days in the follicular phase, your egg isn't mature enough so that when the sperm is trying to fertilize it, it's not going to really be ready to make a healthy embryo. And if you're ovulating too late, then your egg might not be in the optimal condition and really able to grow into a healthy embryo either. So you might be ovulating at the wrong time. So pay attention to the length of your follicular phase. And again, this is something that you can influence with diet, lifestyle, and supplements, as well as acupuncture. Okay. You also just might not be ovulating. This can happen with things like PCOS, polycystic ovarian syndrome. So don't just assume that you're ovulating. I would double check it with an OPK kit at least once. Pay attention to your cervical mucus. And I love doing the BBT, the basal body temperature chart. Because if you're not ovulating, then you're not going to get pregnant. And if you're not ovulating at the right time, it's going to be difficult to conceive as well. Your luteal phase might be too short. And in a related note, you might be low in progesterone. So this would cause you to get your period. Low progesterone causes you to get your period too soon, which would not give the embryo sufficient time to implant into your uterus before the period flushes it out. Your hormones might be out of whack due to stress, lack of sleep, diet, or poor blood sugar control. These are really, really, really common with what I see with my clients. And the good news is these are totally, there are things you can do about all of this. And I think this might be one of the most common causes I see for women having difficulty getting pregnant. You might have low-lying levels of inflammation in your body due to stress, diet, toxic exposure that can damage egg quality, as well as micronutrient insufficiency. And this can all damage egg quality. So I could go on and on about egg quality, but what we've been told, the common dialogue that we've been told is that age is what affects egg quality, but it's not the whole story. In fact, age is not the biggest determining factor of egg quality, but it's things like inflammation, toxicity, micronutrient stores, hormone balance, because your eggs are kind of in an inanimate state from when you're a baby in your mother's womb. You have all your eggs you're ever going to have, and they are kind of just in an inanimate state until 4 months before each egg gets ovulated. It kind of comes to life a little bit, grows a ton, and becomes more exposed to the environment in your ovaries and in your body. And if it starts needing more nutrients and energy to grow, and if it kind of comes awake in an environment with a lot of inflammation or hormonal imbalance or stress or not enough micronutrients that it needs to thrive, then it can damage your egg quality. Okay. Your immune system might be overactive, causing your embryo or causing your body to be inhospitable to a growing embryo. So if you think about it, getting pregnant is kind of like getting a little mini organ transplant, because you have foreign DNA in your body. And normally your body would attack that and have a really strong immune response. But something amazing happens with conception, where the embryo kind of talks to your body and flips that immune reaction off so that your body doesn't attack the growing embryo. But if your immune system is out of whack, if you have autoimmune disease and other problems, then your body could be making it really difficult to conceive and carry a baby to term. And again, you can absolutely influence this and bring your immune system into balance. Okay. You might be over or under exercising. So studies show that there's a certain amount of exercise that's important for fertility. You might be exposed to toxins from your diet, self-care products, and household products, and these toxins can damage egg quality. You might be lacking key micronutrients needed to have balanced hormones and healthy egg quality. So diet is huge, 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 and it's completely in your control. Your thyroid hormones might be off, which can throw off your hormones. Thyroid is really huge for your whole endocrine system and hormone balance, and it's really important. So we're going to talk about this later. I do recommend you getting your thyroid tested. Your male partner might have poor sperm quality. This is also often due to poor diet, toxins, and stress, and can also be rectified with diet and lifestyle and supplements. And you might be older than 45. So if you're younger than 45 and you're in your and younger than your mid 40s, then I don't think age is the issue. I think you can get pregnant, and I think you have time to set things right. I hate the typical dialogue that your fertility falls off a cliff at 35. That's just not true. You can definitely get pregnant into your mid 40s. Yeah. Okay. So sometimes the answer is simple and you can make a small tweak and then get pregnant really easily. So those are some of the reasons that you might not have gotten pregnant yet, or haven't carried a baby to term. So I think you can just go through that checklist, think about it, see what might apply to you. I do recommend that you visit your doctor and see if you can get some answers. Some good tests to ask for are a full thyroid panel, a complete thyroid panel. So that includes thyroid antibodies, T4, T3. It really annoys me when doctors just test TSH, which is thyroid stimulating hormone. That's just not a complete look at your thyroid. Your thyroid is complex, and women so often have undiagnosed thyroid problems, and this really affects your fertility. And for fertility, your TSH should be around 1.5. So for most doctors will think that an okay TSH is up to 3, is less than 3. But really, like 2.5 and higher is going to be bad for fertility. You want it to be closer to 1.5, and a lot of doctors don't know this, so I want you to know that. Another good test is hemoglobin A1C. This tests your average blood sugar over the previous month, and blood sugar and insulin resistance are really tied to hormonal balance and fertility issues. So I think this is a great test to get. These are all really easy tests to get and not expensive. Your A1C should be 5.2 or less. So most doctors will say you're fine if you're 5.6 or less, but once you're 5.6, you're like pre-diabetic. So they're like, oh, you're good, you're not diabetic. But you don't want to just be not diabetic. You want to have optimal hormone balance. So you really want it to be 5.2 or less. And again, this can really be in your control. If this is a little elevated, you just make a few simple diet tweaks and you can balance your blood sugar and your hormones. Yeah. And then progesterone is a great thing to test and just rule out. Most people test it on day 21 of your cycle. But what you really want is 7 days after you ovulate. So if you're ovulating a little early, ovulating a little late, don't get it on day 21, get it on 7 days after you ovulate so that you're firmly in your luteal phase. And that's when they want to test your progesterone. When your progesterone should be highest, that's when you want to test it. And these things are great to test because they're really important and they can be really simple answers. Just get on a thyroid medication, change your diet. You might consider taking progesterone, or you could consider a natural supplement like Vitex, and diet and lifestyle changes that can really rectify these things. So I recommend just ruling things out. It annoys me that often doctors won't do any testing until you've been trying for a year, if you're younger than 35, or 6 months if you're 35 or older. But these tests aren't hard to do. They're not expensive, and information is power. So you can request these tests. Yeah. You might notice that I don't list FSH or AMH here, which are really common fertility tests, but studies show that these are uncorrelated to your ability to conceive. I know, that's huge. And I also see that when a woman is told she has high FSH or low AMH, it can be a devastating diagnosis and they can feel like they're infertile, which is just not true. Low AMH does mean that they would have a harder time retrieving a lot of eggs for IVF in an IVF freezing cycle. But studies indicate that women shouldn't assume that they'd have any more trouble getting pregnant naturally if they have low AMH or high FSH. And in my clinical experience, high FSH can be brought down with diet and lifestyle changes, and which we cover in the Becoming Mama program. And as long as you still have some ovarian reserve, at least as long as you are still ovulating, you still have eggs left. And it's possible to get pregnant naturally if you're ovulating and you have a few eggs left. So even if you have low AMH and high FSH, so as long as you still are having regular periods and are ovulating, I don't think you need to worry about your FSH and AMH. I think it can only cause stress. Yeah. Okay. So go over the symptoms and checklists that we covered. I hope this information is helpful for you. Pay attention to your period. Pay attention to all of your symptoms. Download the quiz to get a good idea of where your imbalance might lie and your pattern diagnosis. See what might apply to you. Ask your doctor for the tests that we mentioned, because information is power, and it can help inform and empower you to make necessary diet and lifestyle and supplement changes and empower you to action. What's important to know is that all of these factors are fixable with targeted and specific evidence-based, well-informed action steps, diet, lifestyle, nutrition steps that are targeted and specific. You can absolutely fix all of these problems. So that's great news. And it will help you get pregnant more easily, maintain a pregnancy. It will also help you feel better. It'll also help you feel your best and bring you into balance and optimal health. And the Becoming Mama program addresses all of these factors because, as we mentioned, because these factors can often go undetected in labs, and as a result, doctors can kind of shrug their shoulders and can't explain why you haven't gotten pregnant yet. That's why, regardless of whether you have a diagnosis or not, and even if you do have a diagnosis, a specific diagnosis, I think it's important to cover all of these bases and address all that checklist of reasons that you might not have gotten pregnant yet. The Becoming Mama program addresses all of them because they can go undetected in labs, and we judge it all based on your symptoms and what we see going on with you. And we can get to putting that right with diet and lifestyle steps, and we cover all those bases because fertility is complex and it involves so many moving parts, your hormones and inflammation and your endocrine system and stress and sleep and nutrition and so many things, and exercise and detoxification pathways. So we cover all the bases, and that doesn't mean it's complicated or takes a lot of steps. It just takes specific targeted diet nutrition guidelines that I love to share with you. So as I said, sometimes the answer is simple. Little hinges can swing big doors. I love that saying, and you can make a small tweak and then get pregnant easily very often. So a natural approach like the Becoming Mama program can help you improve your egg health, your sperm health, rejuvenate cellular signaling, and cellular health. They can improve your biological age, so they can improve your egg quality, repair some of the time-related DNA damage, and reduce chances of chromosomal issues with an embryo. And the result is that your odds of conception and maintaining a pregnancy significantly improve, whether you're trying naturally or through IVF. Even with the extra time you spend doing the program first, your chances improve hugely. So I believe it's time for you to take charge of your fertility. I believe women need to know this information. I feel like too often we're handing power over to our practitioners when really you know best. You know your body best by paying attention to what's going on with it and being empowered with information about what you can do at home with your food choices and lifestyle and supplements, that you have the power in your own hands. I think women should be empowered with this knowledge to take charge of your own fertility. Even if you're going through IVF, these steps can hugely improve your chances of IVF success, and they can help you fall pregnant naturally too. So the Becoming Mama program takes all the guesswork out of it, because I know it can feel overwhelming. There's so much information out there on the internet that can make us feel overwhelmed. Like, oh my gosh, what actually should I be doing? What should I be eating? What should I not be doing? And there can be conflicting information. There can be information out there on random blogs from people who are not making evidence-based decisions. It's not backed by research. They're just making weird claims because they probably read it on someone else's blog. So you want information from someone you trust, someone who has years of experience, is making evidence-based recommendations. And the Becoming Mama program takes all the guesswork out of it and lays it all out for you. Makes it really easy. It's a 10-day program, and you can enroll now. Excuse me, or get on the wait list to be notified when registration opens again. So, excuse me. Thank you so much for being here. I'm so excited to get to share this information with you. I feel really passionate about it, and I wish you the best of luck. And I'm excited for you. I hope to see you inside the program. And let me know if you have any questions. Thank you.